Today is now Tuesday morning. I'm getting ready to take my daughter to school. I remembered from meeting with the breast surgeon yesterday about numbness in my arm. I forgot to talk about that. He did say that the hair-bearing region, so like where armpit hair would grow, that is a permanent numbness. However, all the other areas that I'm feeling that are numb right now, like in here, and hold on, let me try to, like in the back of my arm, underneath from like armpit to elbow, which is kind of coming back slowly. He said that's all just from inflammation and trauma. So it's like a temporary numbness and it should go away. So that's cool. And rubbing it, massaging it, and exercising it helps to speed up that inflammation to go down. But I'll tell you what, it's raining today and my armpit's really, it's not my armpit, but like right in here is really sore. Like right where it connects to my arm. It just feels like I threw a baseball, and I think I know why. Because the other day it was so nice outside. I'll let my dog out in the rain. Sorry, buddy. The other day it was so nice outside, like almost 70 degrees. It was weird. I was in the car and I'm like, oh, let me open up the sunroof, and not thinking anything. I just went whoop and just like threw the cover back. You know how you open up the sliding thing on your sunroof and then you open the actual glass? But as soon as I did that, I was like, ooh, I don't think I was supposed to go that far back, like overextending. So I don't know if I just pulled something because it's super sore. Even just touching it right in there feels like a muscle ache. So yeah, and I'm sure the rain isn't helping at all today. So you know how the rain brings out the aches and pains. All right, I'm gonna get going, take my daughter to school, and I'll check in with you later or tomorrow. Tomorrow I meet up with my oncologist to talk about being on chemo again, but a pill. Not happy about that. All right, so I'll see you in the next clip. Good morning. It is Wednesday morning, March 6th, and I am leaving now to go meet with my medical oncologist to discuss pathology and getting back on chemo. So I'll see you in the next clip. So I'm at my appointment to speak with my medical oncologist. I have like a whole list of questions to ask, including the chemo questions. So I will keep you posted on how it goes. Do a quick room tour before she comes in. Room tour, room tour, room tour. And that's where I'll be sitting. And yeah, that's it. I will see you in the next clip. I just got out of my appointment with my medical oncologist and I feel a lot better. I got a lot of information today. So in a nutshell, I have to because my lymph nodes were still positive and there was lymph node involvement with my cancer even after chemo, I need to be on, well, we already knew that I had to be on a hormone pill to suppress estrogen in my body since my cancer is a estrogen fed or estrogen positive cancer, or it was. So to prevent any future occurrences, we need to suppress the estrogen. So I got the information today about which type of pill I will be on for that. I also have to be on a shot. The injection will be monthly. And hold on, I had this in my notes. The injection is monthly for 5 years. The pill is daily for 5 years, once a day. And then the chemo pill that I will be on is actually not a chemo pill. She said it's like chemo, but it's not. They don't call it chemo. They call it targeted therapy. So that just targets the cells that might be left over or that might have gone distant through my lymph nodes. They're going to check through the full body PET CT scan next week or whenever I get that. And just, if that's clear, then that's awesome. But this is just to prevent any potential metastasis, is that the word, where it metastasizes through your body? This will stop that. The radiation will also obliterate whatever's left, if anything, where surgery happened. So that pill, the targeted therapy pill, is to be taken twice a day for 2 years. So I am going to be on medication for quite a while. So yeah, the side effects that I can expect, which may not even happen, who knows, of the targeted therapy pill is a lowered blood count, like white blood count. So they will be monitoring my blood levels monthly to make sure my white blood counts are good. But in like the flu and cold season, wear a mask because it's kind of like being on chemo. The other side effect is possible bone marrow loss, I think is what it was, bone marrow loss. It was some type of thing where like, oh, and joint pain. So kind of like being on chemo, but no hair loss, thankfully. She said very rarely women experience like thinning of the hair, but she's like, your hair should grow back. Everything will grow back and be normal. I'm going to be monitored monthly with the blood work, and I will be seen by her every 3 months. I'm assuming throughout the whole process. I'll update you on that as we go. But yeah, that's it for now. I don't really know all the names of these drugs yet. I have 3 pieces of paper here, or 3 booklets of paper of each drug that I'll be on. Oh, she said to do the shot now. Like, so next week, I think I go in next week for the injection. My first injection. And what that does is it shuts down your ovaries so you don't ovulate. So it's going to shut down my ovaries, and it's okay to do the shots while going through radiation, but she doesn't want me doing the shot and the pill during radiation. So I have to wait until radiation's all done to be doing the shot and the pill simultaneously. And I think that was the same for the targeted therapy pill too. I forget. The nurse is gonna reach out to me, the nurse navigator, probably later this week or whatever, to go over all of this one more time with me and let me know when to start and let me know it's available at my pharmacy, all that stuff. So I have a bunch of questions because now that I left, I'm sitting here recording this and I'm like, wait, what about this? What about that? When do I start this? Can I take this while on radiation, or are we waiting till after radiation? Bunch of questions. So I'll keep you updated on that, but I just wanted to let you know today's visit went really well. I feel a lot better knowing that it's not chemo, it's targeted therapy, and the side effects are nowhere near as rough as chemo was. And she did say chemo was the hardest part. So just be happy that that's over, and it shouldn't be too bad from here on out. All right, I'll see you in the next clip. Hello friends, it is Thursday, March 7th, and I'm getting ready to head out to my plastic surgeon follow-up appointment to just make sure nothing pulled on the side where the last drain was removed a week ago. And I think we might also discuss reconstruction, if they want to put the expanders in before or after radiation. I'm not sure. Or it might just be like a, hey, we're just checking the drain site today, and that's it. So I don't know. I'll keep you posted on that. But after that appointment, I also have to go over to LabCorp, pee in a cup to let radiation know that I'm not pregnant and I'm okay to do radiation. So there's just doctor appointments after doctor appointments after doctor appointments. So, and tests. Tomorrow is an appointment with the radiation oncologist to do radiation planning and also get a CT scan of my chest, I guess, for a before photo. And then we'll do another scan at the end for an after, just to see how well radiation cleaned up everything. All right, so I'm gonna get in the car and get going. See you in the next clip. Hello, I'm at the doctor appointment, but I had to pee. So I'm hopping in here real quick to say hi and let you know that I have to get dressed and wait for the doctor to come in, and I'll let you know how it goes. Okay, so I'm dressed and ready to see my surgeon. Well, it's actually another doctor because my surgeon is not available today, but this is the plastic surgeon. Anyway, I'm gonna give you a room tour and then I'm gonna sit and wait until he comes in. So we'll go this way today. Exciting room tour. I do it every time I go to a doctor appointment. That's where I'll be sitting. There's my boob, sorry. And yeah, we're back to here. So I will get an update, and he's probably gonna just check the site area, make sure that looks good, and then maybe talk about reconstruction and getting the expanders put in or not. So I'll see you in the next clip. Well, that was the world's fastest doctor appointment. Everything looks great where the drain was taken out. And since this doctor wasn't the one who did the stitching up per se of my surgery, and anyway, I have to see my actual surgeon, the plastic surgeon who is going to do the reconstruction, to discuss whether or not we're going to put the expanders in before or after radiation. So I made that appointment. That appointment is for this coming Monday. What's today? March 7th. So 8, 9, 10, the 11th. So 3/11 day. Whoop! If you're a 3/11 fan, you know what I mean. So 3/11, I will be seeing my plastic surgeon to discuss that. And now I'm on my way to LabCorp to go pee in a cup and make sure I'm not pregnant for radiation, which, newsflash, spoiler alert, I'm not. All right, I'll see you in the next clip. All right, well, I peed in a cup for my appointment tomorrow with radiation, but change of plans. They actually called me while I was in there, and long story short, because I need to see the plastic surgeon on Monday to discuss whether or not we're putting expanders in before radiation or after radiation, that now changes up the plan for tomorrow's appointment. So tomorrow's appointment, they were going to do the CT scan and do these little tiny tattoos in the area to know exactly where to line the machine up for radiation every day. If I'm going to end up getting the expanders put in before radiation, I need to have that surgery first and then do the CT scan, because if skin moves and things move in surgery to put the expanders in, it would mess up wherever they would have put the dots on my body tomorrow. So anyway, tomorrow's appointment is canceled. So I have the day off. That's nice and luxurious, because I've had 3 appointments this week now. Monday, I go see the plastic surgeon, super brief, to figure out what the plan is. If the plan is expander surgery before radiation, then I have to go through that before I can do any radiation. If it is not, then I have to set up what tomorrow's appointment would have been next week or the week after, whenever they're available, and just begin radiation, and I can reconstruct later. Ay, 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 this journey is like push, pull, left, right, up, down, smile, frown, because that's literally how it goes. It's an emotional, mental roller coaster, and nonstop, just nonstop. All right, so I'm going to go home, have the rest of my coffee that is probably now an iced coffee, and get some work done, and then go pick my cute little child up from school. So I will see you in the next clip. Good morning, friends. It is Monday, March 11th, and I'm running late, but I'm getting ready to go to my plastic surgeon again to decide if we're doing radiation next or plastic surgery. Or wait, what? Putting the expanders in, because the tissue can get kind of hard, tough, whatever the word is, after radiation. So I'm just getting an answer today, and then I'll let you know how it goes. All right, I'll see you in the next clip. Okay, well, that was kind of a waste. See you in a second. Okay, so the surgeon that I was supposed to see today is not here today. I actually made an appointment with someone else to loop in the surgeon because she's very busy. Long story short, she's not here today. So the lady I saw today is going to ask my surgeon, what are the next steps? Should she just start radiation and then she can reconstruct later if she wants to? Or does she have to put the expanders in now before radiation so they're at least in there, and reconstruct later after radiation? So I won't get that answer till Thursday. Oh, the never-ending story. All right, so I'll see you in the next clip. Good morning, everyone. It is Tuesday morning, March 12th, and I am getting ready to go get my first hormonal injection. Zoladex is the name, and the side effects are potential hot flashes, bone thinning, joint pain, harder to lose weight because women love that, and vaginal dryness. So let's go. I just can't wait to go get it. All right, well, I got that. Got injected. It actually, the needle was very intimidating. So I'm like, whoa, it's a big needle. It's going to go right in my abdomen. Didn't hurt. It was like, I don't even want to say it was a pinch. Like, you know, when they always clean the area with an alcohol swab. So like, I guess the burning of alcohol is what the sting is, but it's not even really a sting. It's just like, beep, done. Like, it didn't even hurt at all. I was just completely shocked that it didn't hurt. Let me see if I can show you my little Band-Aid. Hang on a minute here. All right, you ready? Go. Band-Aid. So we're good. It was just a little, well, it was a big needle, like thickness wise, but it was super fast. Not painful at all. So if you're getting hormone injections for cancer treatment or post chemo and surgery treatment, to suppress the estrogen in your body, don't be scared. If you're scared of needles, I don't know what to tell you, because I mean, it was a big needle, but it was more intimidating than it felt. Put it that way. It wasn't bad at all. Like, it hurts worse to fall off a bike and scrape your knee. So it's the best comparison I could give you at this point. So I'm going to head home, get some work done, and then I have to pick my daughter up from school. And I'm waiting for the update from the plastic surgeon, because the girl that I saw yesterday, I say the girl, I don't know if she's like a nurse. She's above a nurse, but under a doctor. LPN? I'm not sure. I forget her exact title, but she talked to my plastic surgeon today, And my plastic surgeon said that she would rather put the expanders in now before radiation because the tissue is softer. It's a lot harder to do after radiation. Like, it's harder to get them in and then to expand them later. So my plastic surgeon is now reaching out to my oncologist who scheduled this injection today. The oncologist handles all of the oral chemo and the hormone therapy for the next 5 years, and radiation. So she's going to talk to my radiation doctor, my oncologist, and see if they're all okay with postponing radiation for like 3 more weeks, maybe a month at the most, so I can get the expanders put in and recover from that surgery for like a week or whatever, and then just start radiation right after that. I still have to get a PET scan too. I'm waiting to see what's going on with that, because it's so confusing, because I got a phone call yesterday, I think, yeah, that my referral was denied. But like, what referral? The referral for physical therapy? Was it the referral for the PET scan? The referral for radiation? Like, what referral? Something got denied. And then in my chart, I got 2 letters that 2 of my referrals were approved. So I'm like, but it doesn't tell you what was approved. It's so confusing. So now I have to call my nurse navigator, ask her, did the PET scan get approved or denied? And if it got denied, do you do an appeal? If you don't do an appeal, I still want to have that done. So like, I want that done no matter what, knowing that I had so much cancer still present in my lymph nodes. I just want to have peace of mind knowing there's nothing circulating right now. So yeah, I don't know. I'll keep you posted on that. So I'm going to head home and get some work done and just continue my day. See you in the next clip. Okay, so real quick, while it's fresh in my mind, oddly enough, after I just recorded that last clip, I got a phone call to talk about the PET scan being denied. It was denied, but the only way to appeal it and get it approved, this is where insurance is just crazy, and all their rules and stupid things they make you do to get things approved. I have to go get another bone scan and chest CT scan with contrast, like I did back in August. And once that's done, then insurance will probably approve my PET scan. I think they just need to have like probable cause as to why I would need a PET scan if my scans were clear previously. So I don't know. The whole thing is just crazy. It's like a PET scan shows so much more than a CT and a bone scan would, but whatever. So I have to go do that this Friday. So I'll take you along for that fun part of my journey too. And I'll keep you posted on whether or not I'm getting my expanders put in next week. All right, see you in the next clip. Hello, friends. Today is Wednesday, March 13th, and I just have to update you on something because life is just crazy. There's another little curveball going on right now, and instead of doing, well, everything's up in the air as of today. This is all based on a bone and a CT scan that I have to get this Friday because my PET scan was denied. So now insurance is making me get a bone and CT scan to see why I would need a PET scan. How about because my lymph nodes tested positive for cancer after chemo? That's why. Ugh, insurance is annoying. But based on the results of my scan this Friday, if it comes back clear, I can plan on having my tissue expander surgery done on Tuesday, March 19th. If they don't come back clear, no surgery, just go on to radiation and the cancer treatment journey and all that stuff that I'm on right now. So we'll see what happens. But I just wanted to check in and let you know. The plan keeps changing. It's crazy. And I feel like if you're confused, so am I. So I'm sorry. I'm just bringing you along on this wild journey and letting you see it firsthand. Some days this is what I'm going to be doing, and then boop, the plan changes and we're going this direction now. So if all goes well, I should be clear and have my tissue expander surgery March 19th, which is a Tuesday. And it is a less invasive surgery. It's about 2 hours long. And they just go in on the same incisions that I have now. Not the one that goes up, because I have one that goes up and then one under. They're just going to reopen me here, lift up, put the expander in, and then sew me up. I may or may not have a drain again. I don't know. But I will let you know. And we're going to do this together. And yeah, so I'll see you in the next clip. Walking into pre-admission testing. So I'll let you know how it goes. See you in the next clip. Well, I'm all done pre-op. That was not that bad. It was just height and weight, blood pressure, vitals, and that's it. I didn't need any blood tests done. So I guess they're gonna just use the one that I had done for the bilateral mastectomy, because that was only a month ago. So I'm sure not much has changed. And here's my parking shebang ticket. So I'm gonna put that in the little machine and get going to appointment number 2, which is plastic surgeon. So I'll see you in the next. Ready to do another room tour. Here's my little gown. It's huge. It's like wearing a sheet or a shower curtain. But here's a room tour. And you're gonna see a familiar painting on the wall, which means my grandmama's with me in spirit. And yeah, that's the sink. Room tour. So now I'm just waiting for the plastic surgeon to come in and we'll go over everything. And here's some papers that I got for pre-surgery, like what to not do and what to do, what to eat, what not to eat, all the fun things. All right, I'll see you in the next clip. So all went well for my pre-op appointment. Pre-op, what is it? Pre-admissions testing and pre-op appointment for expander surgery. Now again, this is all contingent upon what the scans tomorrow result as. If they result showing anything, then I don't get surgery at all on Tuesday and I just proceed with radiation. But if nothing shows on the scans, then we proceed with putting the expanders in on Tuesday. And then I have to recover from that. She said about a month, and then I can start radiation. So I'd be starting radiation sometime around May, like the beginning of May or like the end of April. So it does postpone my radiation treatment, but my oncologist is okay with that if the scans tomorrow come back okay. If they don't come back okay, I have to start radiation right away, obviously, because you don't want to mess around with that. So, all right, I'm gonna head home and then I'll see you tomorrow for the bone scan and CT scan. And I'll let you know the results of that because I'll probably get results in the afternoon. All right, see you in the next clip. Good morning, friends. It is Friday, March 15th. It is also the day that I go super early in the morning to go get my chest CT and bone scan. So I will be heading to the hospital shortly to go into the nuclear medicine part. I've been up since 5 a.m. and I don't know why, because I didn't need to get up until like 6:30. Just awake, wide awake, bright-eyed and bushy-tailed. All right, I'll see you in the next clip. Finally all done. Drinking my coffee and I'm happy. Got my bone scan, did the CT scan. Now I'm going home. See you in the next clip. All right, so I'm home and everything went really well. Of course, there was like delays in between the tests because there were 2 emergency trauma somethings going on. So they needed a CT scan or whatever the machine was that they needed in that room. So there's always something because it's at the hospital. So you just never know what's going to happen. But I hope those people are okay and they heal and everything goes well for them. I said a prayer for them. But yeah, everything went really well. I'm home and now we wait for the results, which should come in later today. And then I will update you on those results based off what I can read in my chart. I won't know for sure until a doctor calls me to confirm, like, okay, everything looks good. Let's just plan for surgery on Tuesday. But if I can tell from reading the verbiage of the radiologist's notes, then I'll just assume that I'm good or not good for surgery on Tuesday. But yeah, I'll check back in later today and let you know what the results say. I'll even post them because I don't care. I put all my stuff out on the internet to help other people. There's no HIPAA law here. But yeah, I'll put it like up on the screen, both results of the CT scan and the results of the bone scan. So, all right. I will check in with you later and then I'll probably close this video out so I can get it up before surgery, if I have surgery. All right, see you in the next clip. Hello, friends. It is March 15th, Friday night. and I did get the results back of the bone scan, but I did not get results back of the CT scan yet. The bone scan came back negative, showing no evidence of metastatic disease in my bones. So awesome. Now we just wait for the CT scan, and then I'll know whether or not I'm having surgery on Tuesday. It's like, do I prepare for this, or do I just relax and get ready for radiation? It's just nonstop. But anyway, just wanted to update you real quick. I'll put a picture up here to show you the results of my bone scan. I'll let you read that for a hot minute. And then tomorrow when I get the results of the CT scan, I'll put that up as well. All right, I will see you in the next clip. I just want to pop in to let you know that today is just a good day. And I know I've been documenting a lot, or vlogging, a lot of just like doctor appointments, and now I'm doing this and now I'm doing that. And this is probably like breaking up this whole like update video, but I just wanted to end it on a positive note, because even though I am being faced with a couple challenges and setbacks and curveballs, I still, let me take this off so I can look at you. I still choose to smile, and I am taking things one day at a time. Today, the sun is shining. It was a really good day today. I've been smiling and laughing. I saw a friend that I haven't seen in forever, and we were dancing to music, and I helped her with something at her house, and it's just a good day. It's a feel-good day. My vibration is high, and I'm just ready for whatever happens next, because no matter what it is, challenging or not, I'm gonna get through it, because that's just who I am, and cancer is not gonna take me down, okay? Just so you know. All right, so I just want to check in, say hi, and I hope you are having a lovely day today as well. And hopefully I will get my CT scan results soon, because I still didn't get them. I'm probably not going to get them till Monday when a doctor can review them. So hoping for good results, but again, what's meant to be will be. All right, so I'll see you in the next clip. I actually might just end my video here, only because it is Saturday and March 16th. Tomorrow is St. Patty's Day, and I have a kind of busy day ahead tomorrow. And if I don't get the results of the CT scan until Monday, I won't have enough time to edit this video and get it up in time for surgery Tuesday, if I'm getting surgery. So I'm going to ask you now to just send up a prayer. If I have surgery Tuesday, just say a prayer for me on Tuesday. I will update my Instagram with the CT results to let you know if I'm going to be getting surgery or not. That way everyone is in the loop. So if you don't follow me on Instagram, follow me on Instagram so you can get updated. Yeah, I just want to say thank you for being here on my journey and encouraging me. I read all of your beautiful comments on my last video when I was very upset finding out that I needed chemo again. I do feel a lot better knowing that it's a less invasive, I guess is the word, chemo. It is a pill, and the side effects are very minimal. Just to be clear, I am only on the, I think it's called Zoladex. Zola something. I should know this because I got injected with it. But Zoladex is what I'm on for now. And I don't start the Verzenio is the chemo pill that I'll be starting after radiation. And then the Arimidex is the hormone pill that I will be on after radiation. So if the next step is surgery, I have to heal from that first. It takes about a month to be allowed to get radiation on the incisions. They need to heal a little bit before you can start radiating. So yeah, I'm looking to be done radiation. If I have surgery, I'll be looking to be done radiation by mid-June. If I don't have surgery on Tuesday, I will probably start radiation within the next week or so. So we'll see. What's meant to be will be. I'm not gonna worry about it. I'm not gonna worry about it, because what's that gonna do? It's just gonna stress me out, and I don't need stress right now. So I already have enough of that going on. So I'm just going to keep my spirits up. I want to tell you I love you, and I appreciate each and every one of you supporting me on my journey and being here with me and encouraging me to just like stay strong. Even though I do that a lot for you, sometimes I need it too. And I really appreciate it that you all came through for me and lifted my spirits through your beautiful comments. And I don't respond to all of them, but I do read them all and I love them all. They make me smile. You've touched my heart, sharing your stories with me, and other people reading them. It helps them on their journey as well. I just love this community so much because we really are there for each other always, no matter what. No matter what part of your journey you're in, or even if you're done your journey, we're all together all the time, helping each other because we know what it's like. And even if you don't know what it's like, you know what to expect, what it's like, because there's so many other people helping you with their experience and keeping your spirits up and just thinking positive, because not everything that happens to one person will happen to another person. So it's really cool that we can share stories and, you know, just help each other out during this scary time of need and scary time just in general. So I hope you are having a lovely day and a lovely week, and I will be in touch. I put up a clip earlier in this video to show you the bone scan results, so they were good. Just hoping the CT ones are, and I will let you know on Instagram if they are clear or not and what the next steps are. So yeah, I will be in touch. If no surgery, I will be in touch next week. If I have surgery, I might be out of touch for like a week or so. It depends how I'm feeling. And if like, I'll be recording the whole time, but sometimes I don't get a chance to like sit down and edit. Editing takes so long. Like I could record something that's 30 minutes long, but editing takes like 2 hours. It's just crazy. It's a lot of work, but that's why sometimes I'm like delayed getting these videos up, because I'm editing, because I'm also a little OCD and I like them to be perfect, and yeah, all that fun stuff. So if you don't hear from me after surgery, it's because I'm still recording and getting my video edited. But regardless, I appreciate you for being here, and I hope, as always, I hope my videos help you or someone that you love and care about in some way, shape, or form. I hope it helps them in their journey and keeps your spirits lifted, that tomorrow is a new day. It's okay to cry. And like I always say, you can't have a rainbow without the rain. So I hope you're having a great day. Love you guys, and I will see you in the next one. Bye.